Shalom, welcome to the Jewish View. My name is Rabbi Nachman Simon with the Chabad House of Delmer. We have a very, very special guest with us today, Dr. Gavin Setzen, ENT, ear, nose, and throat doctor in the Capital District. Dr. Setzen, welcome to the Jewish View.
Thank you very much, Rabbi. Pleasure to be here.
Well, this is our part two. This is our second show, but you'll find it very interesting. We talked about Jewish bioethics, or really it's bioethics, but of course I'm a rabbi, so I'm going to put it the Jewish aspects over here. I mean, ethics is a real issue nowadays. It's not like you say, well, something ancient, well, you're digging up something from an ancient Talmud. Well, we do dig up things from the ancient Talmud, but you'll see how relevant they really are, these issues, to cutting-edge ideas that are happening right now. One of the ideas, of course, is birth. Now, of course, everyone knows how a baby is born. They have to use the show for that. But in any case, everything seems simple, but it's not so simple. And I was astounded, and I don't know how many people know this. I figure how many people can't have children. So, you would ask me, I mean, this number of years ago, I said 2, 3, there's always 1 or 2%. And I found out it was like 15%. It's a lot. It's like 1 out of 7 who want, obviously if you don't want, you don't want. But people who want children and they can't have. So, and, a lot of times, it goes the other side, oh, there's too many children in the world. But for that couple who want children, it's an incredible, incredible problem. It's like good and less people in the world. Well, not for that, whether we won't get into that whole issue. But for that couple, I know that it's a very, very big issue, not having children. But that's where medical science comes into play. And it's practically miraculous, what medical science can do nowadays. Over here, I mean, you can say that for a lot of the science in the world around with the computers, but et cetera, but they are working on it because it is a real issue. So maybe explain that, and maybe we'll throw out some of the issues that are involved with it.
Sure, and I'm sure, just, in its basic essence, the family who is incomplete without a child, what impact that has on the immediate dynamics within that family and the extended family, and what a potential problem that could present. And then it raises the issues of potentially, for example, hormonal therapy. And with that comes the discussion about multiple pregnancies and the incidence of twins or triplets or quads or, greater number of pregnancies based on hormonal therapy. That has its own moral issue with respect to the health and safety of each individual fetus, and with a much larger number of live pregnancies at the time, that obviously becomes an issue in question. And then I think halachically, what the standpoint with respect to in vitro fertilization, and that over the years has become a very sophisticated, evolved process as an alternative to hormonal therapy and things like that, in vitro fertilization. And while it's halachically permissible, we saw recently the birth of eight viable fetuses, and what impact that has for that family, for potentially what was an unmarried mom who was not really in a position to support the children, and so the impact on the family, the healthcare system, the community, and every step along the way. I think there are so many psychological, social, and practical issues that arise in trying to determine what the best outcome is. And that case raised several issues about the bioethical considerations on the part of, for example, the obstetrician who was monitoring this pregnancy. Should one have been more selective during the course of the in vitro fertilization to see that there are so many viable fetuses, and to revisit that at the earliest stage of the pregnancy, and how many embryos do you implant, and at what time, or ova do you implant to allow for a successful pregnancy?
Yeah, I mean, because he's, again, obviously just one thing to get pregnant. The other thing is to raise the children. I mean, it becomes a lifetime also, so it's very nice people have children. But yeah, that's a concern also. I know a lot of times, and we talked about abortion before, but one of the issues is psychological. We talked about, really, just to review, said maybe people haven't seen it, obviously if the woman's life's in danger, and something's wrong there in the womb. But on the other hand, there's a psychological idea too. What does that mean? I mean, a woman just having a few children, she can't handle it anymore. And who's to say, again, every person is different. Some people, 2 children, it's like, I'm going crazy. I have a kid screaming, 3 years old. I have a 1-year-old kid. I have to diaper, now I'm pregnant again. And, some people, so other people, well, a lot of people have 3 children. It's not the biggest. Well, for that person, it is a big thing. I mean, every person's different. So therefore, she's really, really becoming a medical issue, because she even contemplating suicide. She can't take it anymore. So, I mean, psychologically, that's beyond more psychological suicide. But on the other hand, those are issues. It's not just going through the pregnancy, but now you have 3 screaming kids in your home. And, it's a trouble with a lot of people. And that's why sometimes you have children abuse, and they say, well, the kid was screaming. This guy, you say, well, you don't hit a child. What kind of business, because they're screaming? That's ridiculous. Well, for this person, he couldn't take it, so you have to deal with it. There's no excuse, God forbid. But on the other hand, every person is different. They can't stand 2 screaming children,
Sure.
And getting up middle of the night, you're bothering me and stuff like that.
And that brings in so many other aspects to education and counseling before embarking on something like that, and also to know, in medicine, informed consent is such an important thing, that patients really understand the risks, benefits, and alternatives to something that they're agreeing to. And I think halachically it makes eminent sense, and from a medical perspective as a patient, you want to know exactly what the potential good side of any potential treatment or scenarios, as well as the bad, because for exactly all the reasons that you mentioned. So here a young mother is now in this situation, and it raises something that we'd spoken about previously, the potential, if she had 8 viable fetuses, was there even a discussion about potentially termination of pregnancy? And then she's dealing with potentially, I couldn't have children, now I'm having 8, and you want me to give up 2 or 3 or 4 of them? And can you imagine the psychological trauma of having to make that decision in the midst of a pregnancy that's maybe not as well monitored as it should have been? And then all the family dynamics that follow having had the 8 children.
It's interesting. Well, on similar idea, the idea of cloning. Now they clone a sheep, it looks nice. Or, the idea where, they're saying, well, I like blue eyes, I'll just pick out my, my child and from a diagram. So that becomes a very big issue. That's something very new over here, surely in the world, and so the rabbis haven't dealt with that also. We have to understand, is that worth it? A person wants, I'd like 2 children that same way, 2
Sure.
for the price of 1 over here. But that's a real hard issue over here to deal with also.
I couldn't agree more, and we've seen the whole emergence of the embryonic stem cell debate and the potential opportunities in terms of healing and preventing certain devastating diseases and common conditions, whether they're cancers or diabetes or multiple sclerosis, spinal cord injuries. There are so many incredible potential opportunities there. And then, the concept of the slippery slope as a biomedical, ethical, and Jewish consideration is making the right choice and the right decision and staying on the right side of that decision, because anything less than something that's permissible or safe or allowable, whether it's in the context halachically or the legal framework for the area that you live, in the time that you live, it becomes very difficult if you don't adhere to all those guidelines and parameters. And then the concern, particularly whether it's embryonic stem cells or cloning, is the potential for misuse and abuse. And if that is the case, then how does one ensure or prevent that cloning is not done for sinister purposes, or that you see and read about organs that are being produced from cell cultures in a laboratory, and what's to prevent somebody with the wrong intentions from making this into a business venture and selling kidneys or selling organs to patients who are in desperate need, and it's a life-threatening situation. So I think that's the thing: monitoring, controls, and trying to do the right thing to prevent the misuse, abuse potential, particularly as it relates to cloning.
Yeah, I just wanted to relate to people. People think, well, medicine, what's so bad? Everything's good. They're figuring things out. Well, I mean, just to compare and contrast to another society, which would be Nazi Germany, and there you find that medicine running amok. Now, they were the advanced society. They weren't some, third world country at that time, and German medicine was advanced. And that was one of the things. The head person at Auschwitz was a doctor, and he'd pull out twins, for example, for his medical experiments. So they weren't just, oh, kill him, kill him, kill him. I mean, they did that, but there was also a sinister idea of medicine. And they would sit there and choose, oh, this one, and it started, and it's really a very interesting subject, where you're saying the slippery slope of medical bioethics, where they just said, oh, that kid's retarded, meaning useless to society, whatever was wrong with the child, and okay, let's kill him because the kid's got to eat. You're wasting our time, you're wasting our resources. We're trying to make a good society here, top-notch society, and these people are just worthless. And, they aren't worthless, but the Nazis, they were worthless, and they started killing them. So then when you start saying that, well, look at that, here's another segment of society are worthless, here's the, finally got down after a few years to the Jewish people, and to regular people. So you have to be careful with that idea, and that's what we're really kind of talking about. It's not just, oh, well, medicine does the right thing. So medicine has to be guided by ethical issues over here. So I think that's a very important idea. That's what we're, discussing right now. Certain things could run amok. Say, oh, sure, surely there's a big plus side for it. The more knowledge of medicine, like you say, harvesting kidneys. If a guy needs a kidney, that's the greatest thing in the world. So it's a very big plus, but then you say could be a very downside of this, and who should live. And then, you start picking out, like I said, blue eyes. Oh, my kid doesn't have blue eyes. All right, I don't want him. He's a reject. Let's kill him, that idea.
Sure. And the point that you make, I think that is so great, is it always comes back to the framework and the Talmudic teachings and things like that, which will always guide those decisions now and 2,000 years ago and 5,000 years from now. And unless we can make those decisions and use the frame of reference as a guide and a boundary, I think that's how we can maintain making good ethical, medical, and religious decisions as it relates to healthcare, because things like eugenics or selecting out certain characteristics in human development and cloning is such a scary potential thought that there has to be that constant frame of reference to ensure that there is no abuse or misuse.
No, I think it's important. That's why I say that's focusing how important it really is, because people just, oh, medicine, that's, whatever they do is good over here, and they have to be a little bit careful. Human life is so important, and, you don't want to make, like you're saying, business out of, people. I know with adoption, people pay money for children. So, you don't want a children market, you don't want a kidney market, on the
Absolutely.
internet.
Absolutely. It
how much-
becomes a commercial issue as opposed to doing the right thing for a particular patient. And, the Mengele and the perversion of medical science and rationalizing what one does to make it almost seem reasonable. And, for any other person, when you look at that, it's an abhorrent, unimaginable situation, but not allowing things to go the course of that slippery slope where it becomes hard to pull back from that. And that's the thing to ensure, because it extends, especially today where the technology is so sophisticated, genetic engineering, genetic testing, the ethics of genetic testing. I mean, that's a whole other controversial subject. While it would be wonderful to be able to do some genetic testing and determine who's at potential risk for a problem or intervene in utero or early on in life to prevent a bad outcome, is that something that might be misused in another fashion by an insurance company who now may deny somebody health coverage or life insurance because, well, your blood test showed X, Y, and Z, and statistically you're not a good insurance risk. So balancing...
Yeah, that's a very important idea. Insurance is, we can go from one, that idea and work on that also. And I know many doctors complain to me, where they're giving a medicine, insurance says, well, we don't want that, it's too expensive. Well, that's the medicine I think is going to help. So, now becomes, again, an ethical question. Really, it's more not in the medical, it's more in the insurance, but obviously has a bearing on the medical trade. Should we force them as a society? There's a medicine, the doctor says it's going to help. You have to, you said you're insuring this person, you have to give that medicine.
Sure, well, that's a good point. And I think each of these points raises so many other nuances and issues. And then you think, well, if every medication has the potential for side effects. And so, you're trying to measure whether one is making a medical decision in terms of treatment or prescribing a medication. The first tenet of, do no harm, and trying to ensure that you're providing the best and optimal care. You're prescribing a medication even though you know that there may be the potential side effect, but on balance, the good is greater over time. And so when you mention the allowing a physician to prescribe a particular medication or not, there's the whole debate about generic medications and what impact that has on the cost of healthcare, and then you can provide additional healthcare to so many other individuals. So is it preferable to provide what might be the better medication giving a 5 or 10 or 15% better clinical effect to a particular patient, or for the whole system try and be able to free up resources that'll potentially cure many more people? And I think that, that's an interesting concept too.
Yeah, because we were talking about research in first time, but that's also, there's limited money. It'd be very nice to have enough money for everybody,
Sure,
for everything, but obviously it's not true, and you got to deal with reality. And we talk about research and that. Where should you put money into research? Or, you have to allot your different resources to the things that are more beneficial. And whenever you pick something, someone else is going to lose. Like you say, if there's a plus side for one, good, we'll put money for this disease. Wow, that's great, we're going to cure. But then, in the meantime, somebody's suffering from another disease, and we don't have the money to cure them. So every plus, there's a minus that seems to happen. But these are the tough choices, and just again, for our listeners, this is what we're bringing out here, is just that these are cutting-edge issues, that there's not clear-cut answers also. It's very difficult sometimes to figure out the right thing, what to do, and there's tough choices because somebody's going to lose over here.
And I think also to mention, I think some of these treatment options, for example, today are very complex and not straightforward. particularly for cancer diagnoses or major medical problems. And I think a team approach is a very important thing. The physician doesn't always have the right answer or the best answer, and so working with a medical ethicist or a psychologist and a rabbi or others in a team approach for a particular patient can be invaluable. And one shouldn't always feel that as a physician you have to make the principal decision for that patient. I think it has to be individualized, because there are so many different factors that come into decision making and treatment today. And there are a lot of great resources, bioethicists, rabbis, and others in the treatment team that should be considered in helping a physician and certainly the patient make the right choice.
Yeah, it's interesting. Well, there's like a lot of times that we were talking with the abortion, just a lot of hard choices to be made, but choices have to be made, even
Sure.
though they're hard. So we went through a lot of a lot of times that we going from birth, a lot of birth ideas to the death ideas, when to pull the plug. That's always a major idea, and we get that more as a rabbi. The old person, they're dying. Why should they suffer? Just let them go and be at peace in the next world. Sounds nice, better a person be at peace and then suffering, but again, that's ethical. Sometimes what we think would be better doesn't necessarily for society as a whole. It's
Sure.
a tough issue, well, you want them to suffer.
Right, and that
You don't want anybody to
that's
suffer,
a difficult debate on many levels as well, because it's also different when it's your family member and you're personally involved versus possibly somebody remote so that you're not really involved with and hear about a situation. I think it's a very intensely personal problem and decision, and I think sometimes patients will look to their rabbi and their physician to say, what do I do about mom who's 94 and on a ventilator and not expected to survive? Do I withdraw care, or do we wait and see what happens? And I think that's probably one of the most difficult decisions to make. And it raises the question of so-called advanced directives or a living will, so that one potentially has thought that through before getting to a particular age, or even at a young age, so that you can have that discussion with your family and rabbi and make a decision about what may be appropriate for you or your family, and not necessarily put somebody in the position of having to make a life and death decision for somebody else in the family or a friend or a relative, because that's such a hard thing to do.
No, excellent. Yeah, especially again, really when medical science is so advanced, these questions, everything we're saying are really fairly new. I mean, surely cloning and surely these kind of ideas, but even the, ventilators, people die, they die, you let them die. There's nothing that much you could have done about it 50 years ago.
Sure.
And now there's so much that can be done. So it really, if anything, I said it's on the cutting edge, the most cutting edge. These are very, very modern issues that they didn't even deal with over here, even 50 years ago, let alone.
Very much so, and I think we're going to see more of that because of the burgeoning of the older population and the baby boomers, and the potential to cure more diseases and the potential for longevity. So those problems are going to increase, and brings up other issues as it relates to the delivery of health care. And they say 80% of one's healthcare expenditures in the last 2 years of life, and how sustainable that makes the system over a period of years, and how costly that particular form of healthcare is in those last days if there's no realistic expectation for survival. So there's so many different factors that go into these kinds of decisions.
So we're talking about money, I'm just saying the hospital beds. Someone told me, and they were in the social work field, said the people living over 100, and just be sure I get this right, is percentage-wise is the fastest growing sector of our population. So now you have people over 100. It's not before one guy over 100 is a big thing.
Sure.
You know,
sure.
like here they're the fastest growing. There's more and more people over 100, and of course, you know, they're not probably, you know, hopefully they are jogging around, but you know, again, they need so much care, and we can just say the home health care, you know, even without the surgery and the actual hospital care, that, you know, how many people, 100, can just be by themselves, and, you know, they need the resources. So that it's, and like you say, and the statistics in America are just that seniors are going to be, you know, overpopulated, not I don't say overpopulated, but just the biggest population compared to the younger people, saying their Social Security is the issue.
Right.
We're dealing with not some political science here, but even medically, you know, the health insurance they're paying for, and then the government's paying for their medicine and their pharmacy and so much money, and can society bear that amount?
Sure.
But these are going to, you know, a lot of it comes down to money. I mean, a lot of it's life and death. You don't want to kill people, you know, of course, but
Right. And
I mean,
quality
money's
of life,
yeah.
I think, becomes a big consideration as well, rather than see somebody recover and have no cognitive function and be, you know, in a nursing home bed with absolutely no communication or
Yeah.
quality of life is also, you know,
Big
not a
factor.
pleasant
I know, just, I mean, we only have a minute left. I know that one person, I mean, he was very Jewish-minded. He came to synagogue every day, and they said, well, Dayal says, you cannot go home. This is not a life for me. You know, that was my whole life. I'd
Sure.
go to synagogue every morning. I'm just even like that, even without the medical issues, maybe you could survive, you know, and maybe be happy, you know, living that way, because if I don't have that, you know, I don't have my community, I can't be with them, it's not worth it. So in any case, we run out of time, unfortunately, because it's been really a very, very interesting discussion with Dr. Setzen here. But I mean, just I hope the viewers also appreciate that, even though we're talking about, you know, from my point of view, rabbinical issues over here that are thousands of years old, on the other hand, we're dealing with something that is the most cutting edge, because the more medicine is able to cure people or help people, it does open up a whole different section of ethical behavior on behalf of society. You know, surely doctors and maybe clergy, but it's really all of us. Everybody has to think about, you know, where they want to put their government dollars, or, you know, what, you know, may come down to their mother, you know, and stuff like that. What should they do with their mother on a ventilator? So everybody ultimately is going to have to, you know, advise with professionals and see what they have to do with these issues.
Absolutely.
All right, thank you very much.
Thank you
It's been
very
very
much,
wonderful.
Rabbi.
Thank you.
Thank you.